More than $2 million is coming to Windsor to strengthen police partnerships with healthcare and social service agencies. It marks a long journey from tension to collaboration, a shift that's changing how emergency response looks in our city. Let's go to CTV's Sanjay Maru now with the story.
Michelle, officials say these kinds of partnerships between nurses, police, and social workers, they were unheard of a decade ago. For years, there was confusion, even tension, as to who should be tackling mental health calls. But those walls have since come down, and new provincial funding means 3 unique programs can not just keep operating, they can expand. The Ontario government is investing more than $2.2 million to strengthen how Windsor Police responds to mental health, addiction, and community safety concerns. $500,000 will help the nurse police team continue pairing officers with nurses from Windsor Regional Hospital, a partnership that's handled nearly 2,000 calls this year, providing on-site care to 151 people and diverting 460 potential ER visits.
When I went to nursing school, I didn't expect I'd be riding in a police car, but here I am. Times are changing. Healthcare is dynamic.
Another $632,000 goes to the crisis response team, which pairs social workers from Hotel Dieu Grace Healthcare with crisis-trained officers. They handle roughly 340 calls a month, serving more than 1,000 unique clients in 8 months, and often preventing people in crisis from ending up in jail or hospital.
You see people kind of at their lowest points, and it's a real jumping off point for them to kind of make a change.
And the problem-oriented policing, or POP unit, receives the largest share of $1.14 million to keep targeting high-need areas like Glengarry, where property crimes are down 45% since the project began last year.
We could have a press conference or a media day, and then we'll have to pack up our stuff and go and be VIP protection for that. Or then a protest will pop up, could pop up this afternoon for something, or a labor dispute could pop up, and then we'll have to redeploy to that. So it's just flexibility and him being adaptable.
Windsor's police chief says the funding rewards collaboration that once seemed unlikely when mental health calls were seen as someone else's responsibility.
You have to evolve from a not my problem, it's a your problem thing to, well, it's an us problem, right? Mental wellness and physical health is directly related to the crime stats.
And officials say this model of police working directly in tandem with hospitals is seeing more than just simple benefits. It's setting a standard for others to follow. In fact, Windsor Regional says officials from 7 hospitals across this country have visited Windsor to learn from what's being done here. Michelle.
Excellent. Thank you so much for this. Sanjay Maru reporting tonight for us.